Hello, my YouTube family. This is Jason from Edulogics, where we teach you logic behind things. If you're an overseas registered nurse who's currently pursuing the outcomes-based assessment pathway for nursing registration in Australia and you have passed the NCLEX examination and now looking forward towards your OSCE examination, this video is for you. In my today's video, I am going to share some of the best practices that you can follow to excel in your OSCE examination. So my first tip is to thoroughly read and understand the AHPRA OSCE handbook. The AHPRA OSCE handbook is the compilation of critical information about the procedures, the settings, what to expect in the examination, frequently asked questions, and even free resources for your OSCE preparation. So before you start any course or any preparation, my advice would be to thoroughly go through the OSCE handbook and understand each of the points. Make sure to write down all your questions and talk to an expert who will be able to guide you with further information. You can also contact AHPRA if you have any questions that you think that nobody is able to answer. Please feel free to ask AHPRA for any kind of clarifications that you need. My second tip is to enroll in an OSCE program minimum 3 to 5 months before your examination. As you must be aware, there are many providers in Australia who offer structured OSCE training program that may help you to pass your examination. Before you choose where you want to go and study, make sure to ask them whether they provide unlimited support or unlimited practice hours in lab so that you can digest all the different information that you're getting slowly and steadily. And most importantly, practice is the key for your success. So after your face-to-face sessions that they may have, they should be able to provide you unlimited practice hours in lab so that you can redo and practice again and again to build your confidence. If you enroll in a good quality program 3 to 4 months before your examination, this will help you avoid any last minute preparation and confusion and stress that comes with it. My third tip is regarding time management and communication. As you must be aware, there are generally 10 OSCE stations, and each of the OSCE stations there will be 2 minutes of reading time and 8 minutes of performance time. If you have limited information about OSCE examination, I have done a detailed video about it. Make sure to watch it by clicking on the I button. As you can understand from this that you have only 10 minutes or in fact 8 minutes in your performance in each of the station, time management is very crucial. Initially, when you practice the procedures and the scenarios, make sure to understand each step patiently and also grasp the rationales behind each of the step. Once you have done this and you have done multiple repetitions in terms of practice, then slowly start timing yourself. Practice each procedure intensively in the 8 minutes in such a way that even if someone wakes you up in the sleep, you should be able to do steps automatically. Also, as mentioned in the AHPRA OSCE handbook, communication is a critical component that AHPRA assesses. So make sure that you follow the principles of therapeutic communication when you talk to your patient. Have an effective communication if you get a scenario in which you have to communicate with other fellow colleagues or team members. My fourth tip is regarding OSCE mock examinations. Now, OSCE mock examination is nothing but doing the 10 scenarios back to back, just like you may face in the real examination. Now, this is also an important factor to consider when you select your education provider. Make sure to ask them how many mock exam days will they be able to provide you during the training. Also, make sure to ask them whether there will be revision days just before your actual examination. Make sure when you do the OSCE mock exam, You treat each station as a real life situation and you communicate effectively with a mannequin or a simulated patient, whichever is available. Doing the 10 stations in the mock examination scenario will help you boost your confidence, time management skills, and also will give you a real life feel of the actual exam environment. Make sure to have a frank discussion with the trainer or observer and try to understand where you went wrong and what were your good areas. My fifth suggestion is about practicing good documentation. Most of the stations in the OSCE examination may include some kind of documentation that you have to do. This is many a times neglected by the students. Hence, when you practice your mock exams or do your procedures, make sure to practice good documentation principles and include the critical information about the patient. If you follow these mantras, I am sure you will find it much easier to prepare for the OSCE examination. And if you need any guidance or help, make sure to contact us anytime. I will leave our contact details in the description box below and give us a call or get in touch with us if you have any questions. Hope you enjoyed our today's video and found this information useful. If you did, please make sure to share it with other nurses. Until next time, bye everyone. Stay safe and stay happy.